So as far as our breast imaging equipment at St. Louis University, we really have cutting-edge equipment. We have tomosynthesis for mammography, which is also known as 3D mammography. We are exclusively performing 3D mammography on all of our patients. We have dedicated breast radiologist, and we also have dedicated breast technologist. This is all we do all day long. 3D mammography is a superior exam to traditional 2D mammography, which we did in the past. The reason it's better, instead of getting 2 pictures of each breast, we're able to get multiple very, very thin images, about 200 to 300 images per breast, so that we can find little tiny cancers. So with tomosynthesis or 3D mammography, we find significantly more breast cancers when they're smaller, more treatable. We also are able to decrease what we call our false positive rate, meaning we decrease the amount of women that we think there might be an abnormality, but when they come back, it turns out to be normal. Currently, when we perform a mammogram, about 90% of mammograms are read normal when we do a screening mammogram. About 10% of women need to be recalled for additional imaging, but the vast majority of those exams are normal. When we add tomosynthesis or 3D, we can greatly decrease that rate of women that we call back, and we can find more cancers, so it's definitely a better exam. We also have specialized ultrasound equipment dedicated for the breast. Equipment that we use to do ultrasound on the breast is very different than equipment that we might use to scan a liver or a kidney. So we have dedicated equipment. We have dedicated sonographers, which are technologists to perform the ultrasound. They're all female and they're all specialized, and they work full days in the breast center with us. And we also have dedicated breast imagers to interpret the ultrasound. Every woman that gets a breast ultrasound at St. Louis University, if they have an abnormality in the breast, such as a lump, the radiologist will also come in, examine the patient, and scan the patient after the technologist, and will talk to the patient and give her results. As far as breast biopsies, we have the latest equipment for performing 3D or tomosynthesis breast biopsies. We're one of a few centers in St. Louis that has a prone, which means a woman can lay on her stomach, biopsy table for doing 3D or tomosynthesis biopsies. And this equipment is really superior to the older technology for stereotactic guided biopsy, because we're able to do the biopsies much quicker, which is better for the patient, better for the physician, and we're also able to biopsy very subtle or difficult to see areas that might be very early cancers, so we can pick them up much sooner with this equipment. We also have a high 3 Tesla magnet, which we perform our breast MRI scans on and our breast MRI biopsies. We have what we call dedicated coils, which mean we can examine the breast with the most high resolution equipment. And if a woman needs a breast MRI guided biopsy, we have the most up-to-date equipment for that. We have experienced technologists and experienced radiologists, so we can accurately perform the biopsy in a safe manner.